I was diagnosed at 27 after a year of multiple medications. Like we went through the whole rabbit hole and then eventually got diagnosed. And I'm still having trouble getting a diagnosis for my daughter.
So what would you say to somebody who's queer or neurodivergent or visibly different, who's just starting out OT or ABA? Like, what would be your message to them watching now?
I was working at a clinic before I did in-home, and they were starting to, only scrubs, only this, you gotta look professional. And that just, again, it started to bring me into this box again.
All right, guys, welcome back to Beyond the Science. We are live here in our studios here in Atlanta, Georgia, and I'm with my fantastic co-hosts, Joseph Adams and Darius Cooper, and we have a special guest with us here today. All right, so Michelle, now, before I kind of go into a little introduction and everything like that, this has been an episode that we've been planning out for like the past few months now. Yeah, past few months, and it's from you saw us on TikTok, we saw your journey. We're really hyped to have you on. You bring a powerful and important voice to this conversation. The way that you're going to be talking about blending neuroscience and sensory awareness and your unapologetic identity. I'm really excited to kind of dive into this today. Fellas, welcome to the show. All right, for our listeners who don't know Michelle, you don't follow her on TikTok, can you just kind of tell us a little bit about yourself and kind of your journey to everything that you're doing now?
Yeah, so I am a millennial, and I was born in Dallas, Texas, raised in El Paso, Texas, and now I'm raising my children in San Antonio, Texas. I mean, a little bit about my journey basically starts when I started nursing school, and I became a nurse assistant. I'm glad the school closed because I almost didn't pass my second semester. So I was like, this is not for me. After that, that's when I learned a little bit about occupational therapy. And then I'm like, oh, this is nice. Like nurses are a little sad sometimes and OTs are walking in there like, they don't have to work nights and things like that. So I was like, I want to go that route. Went the OT route. And then I guess I started coming into some barriers with behaviors. And I'm like, okay, instead of like shying away from that, how about I go and attack that? So looked into psychology, actually. And then I came across ABA, and I was like, I had no idea that it was based on this beautiful science until I entered the first day. Then I'm like, this is so dope. Like, I was in it. And I just made this crazy change. And then now I'm here in the ABA world and shared a little bit about my journey with passing the BCBA exam first try. I guess why I went the TikTok route was because everyone kind of recommends you to take the exam with mock questions, read Cooper. I'm not reading Cooper, okay? That is way too much. I don't have time. So I guess I went a different route and that no one really talked about. And I'm just kind of like, let me share this on TikTok. And I kind of shared it and it just blew up. And I ran with it. Yeah. I ran with that, yeah.
So let me ask you, how many times did it take y'all to pass a BCBA exam?
I actually passed on my first try as well.
I did not. I have a different journey. 2000, what was COVID? So I think I was trying to test through COVID where I was trying to fly like to Arizona. I had to test in Tennessee, like South Georgia. So I was in the 390s crew for 5 times, then I passed. So I was 390. I got all the way up to 398. So from 392 to 398 for 5 consecutive times.
I love that, Michelle, you talked about, because some people aren't really into reading Cooper and doing other things. So I love that you've kind of made it accessible in a very different way. Now, one thing Michelle did not share with you guys is that she is an OT and a BCBA. Now, I only know 2 other people in this entire country that have that OT BCBA credential, which means it's very... Now, I do know a little bit more SLPs, BCBAs.
Yeah.
Yes.
So can you guide us through what first got you into OT and then what made you want to go to BCBA route as well? And talk to us about how you use both of those or what you're doing now.
Yeah, so I guess the OT, okay, it starts with me wanting to teach. And teaching wasn't right? I went from nursing to teaching. Like, I don't even know where to go. And I feel like OT brings a lot of, like, increasing independence while teaching someone. And then, I mean, what is your occupation, right? my occupation is being a mom. I'm an employee. You could just think about everything we have to do to be independent and successful in life. And so I thought that was really cool. So I was like, okay, I am so down to do that. I was actually going to work with adults. And then there was no jobs for that at the time in El Paso. So then I went the pediatric way and I loved it. And I had kids at that time, but kids scared me. Like, you know, I guess I just didn't know how to play with kids. So I was like, I don't know if I want to go that route. So loved it after that. I started getting the hardest patients. I'm not going to lie. A lot of behaviors, but I knew how to just handle that. Like somehow I was like, just give them to me because I don't want nobody else to be in situations where one, they're giving them up. Like, to be honest with you, but like, I can't handle that. Like somebody else. So I'm like, I don't want that. Bring them. I'll just, whatever we can do. And then I feel like I still got progress, but very slow progress. And I'm like, there's something else that I need to do. And so then I learned about ABA. I worked at this clinic that had all disciplines and we would teach each other. So every Thursday we would get together and then we would do like presentations and like I would teach what OT was, speech would do speech, PT, you know, ABA. And then it's like, I learned a little bit more about ABA and I was like, how are y'all getting even more challenging behaviors? And y'all seem like you're doing great over there. So I want to know if progress is showing quicker, how do I do that? And I realized that there's a barrier now because OT teaches you nothing about behaviors, nothing, not even to prepare you on what you're going to see in the field.
Wow.
So then that's why I was like, I need to go back and find a way to attack that, I guess, to support that. I love that. I
find that, first of all, love to hear about your journey and kind of what motivated you to do what you're doing now. The last thing that you said is interesting to me about OT schooling and coursework not preparing you for behaviors. And while I know it's not that specialty, a lot of OTs do work with individuals with, would that be accurate? A lot of individuals with problem behaviors?
Yes.
Is that accurate? Okay.
Yes.
So, I mean, and maybe that's something, too, we can dive down the line, too, of how we can integrate that because I don't see as much collaboration as I would like with behavior analysts and OTs. And we talk about collaboration a lot. And outside of me being in the school system, I don't see a lot of that collaboration. Why do you think that is?
Ooh, I feel like I think there's just no understanding of each other's fields because I entered the ABA world and I'm just kind of like, y'all need help with OT stuff. Like, there's nothing that helps support that. Like, what if we have universities create, I would say, a class where we meet all other individuals that are working close to the same field, speech, OT, ABA, and kind of learn about each other, kind of like what the clinic did, right? The clinic was kind of like, come on, give us what you got. Like, how can we better support you in your field? I think that's what changed my mindset and the way I think. And imagine bringing that into universities and
powerful.
Just sharing what you have to share. I mean, think about students. Students have the passion. I had the passion in school. Maybe that changes afterwards for some people, but you have passion in the moment. And so if you can kind of start to mold that, it's going to make a huge difference in the way. Yeah, for sure. Yeah.
Cool. What do you think, man, when you hear about her journey, kind of what she's doing and, you know, her credentials that she got? What comes to your mind?
Honestly, I think it's amazing. I think that, you know, with such a diverse background, you're able to give information that a lot of just BCBAs may not have, a lot of just RBTs. Because at the end of the day, PT, speech, ABA, it all kind of flows together, but it doesn't, you know? Like, it all is something that, like, it should... Like, in ABA, you work on speech stuff, you know, like, but I've worked in clinics where a kid will go to speech for an hour, you don't even know what they did. Like, we're not even communicating, we're not on the same page, and it doesn't really make sense because, you know, for DTT, you're working on fill-ins and interverbals, and you're working on stuff that, you know, probably correlates with speech, and OT and a whole bunch of other stuff. So I think the bigger conversation is how do we start coming together as a community of therapy? Yeah. And, you know, really just everybody being on the same page and working together.
Yeah. I also think it's like a personal thing because like I've met a lot of individuals where I'm like, why aren't you as passionate as me? Like, why don't you want to figure out the answer? And I mean, there's a lot of reasons, right? Is it pay? Is it the horrible company you probably work for? Because I've worked for many. And then, you know, that sucks the life out of you. And then, like, where does your passion go from there? That's the thing that I always think about. But then I don't know. Again, individual, like me as who I am, I'm just kind of like, I'm a go-getter. Like, I want to learn more. I actually want to learn more about ABA stuff because I feel like I use more OT stuff in my practice. So I guess I want to learn a little more of that.
Yeah, talk to us a little bit more about how does your neurological and sensory lens influence your behavior analytic lens and what you do in your practice?
Okay, the way I see the body is like legit a whole neurological system, right? We have those neurons. They talk to each other. And sometimes what happens when your body starts to react and receive information and then react a certain way, it's those neurons that are like either misfiring, right? Something's happening. You're going into fight or flight. Your heart is racing. You're eloping. You know, that's what the ABA words are. And then, you know, you're over here like the functions elope. Like, let's focus on him not eloping. And it's like, whoa. The way I see it is that heart's racing. The body's reacting the way it shouldn't be. What's going on? And so even if we give them like those coping skills and things like that, it's kind of like, it's a lot of practice for coping skills. Like, I'm still trying to develop coping skills as an adult who has not only experienced trauma,
That's true,
trying to get through that. But at the end of the day, it's like, I don't know. I wish everyone kind of understood the body in a neurological way to understand that there's more to the story.
So I always hear this term in OT, proprioception, and so if you can explain that to our viewers, because it has a ABA lens to it and why kids do what they're seeking out for. And I hear it many times in IEP meetings. I'm starting to use it a little bit more in parent trainings. But when that kid is an extreme seeker of that, can you just explain? Because I work with a lot of older kids and they kind of seek that. They love that tactile reinforcement that's like rough and just, bam, and hits and hugs and high fives. But just explaining that concept. I think that's really cool because that's just the thing that we talk about.
Yeah. So the way the system works with proprioceptive input is we want those the bones, right? And then we have the squishy stuff in between those bones. And then this is what's happening. All those bones are happening. And so when they're seekers, a lot of times if you're on the spectrum, you just need either excessive or it's too much, the way our body interprets it. So you think about it this, your senses, again, are they interpreting it where it's like, oh, I had enough with just running, or I had enough with just jumping a little bit. Sometimes it's just not enough. They just need more. And so what happens with the body when it receives it, it's kind of like, think about it. We work out, right? Yeah. Think about all the things we can do to receive that children are probably not receiving anymore because of the times that we live in. Back then, what do? We climbed trees. We would hunt for our food, right? Remember, we used to hunt for our food. This is what our bodies are made for. And we're not doing that anymore. And then we're busy with work. We're busy with school. We're busy and then tablets and this and that. And so we're lacking a lot of that. So then the system just somehow is just so unbalanced. And so what we need to do is provide even more and more and tire them out. Like, if you work out at the gym, don't you feel good? Don't you want to just relax and sit back and just be like, oh, I feel so good. I feel good. I feel regulated. That's what regulation means, is being regulated. You're good. You're at here, right? But then it's not just about proprioceptive input. It's about your vestibular system. It's about, your vestibular system has to do with liquid in your ear. And, that works on balance, receiving that information of the way your head is positioned in certain ways. So there's kids who don't even tolerate swinging, going down the slide. Have y'all noticed that they're just like this fear? Yeah. They're not aware of how that head shifts around with that liquid in their body. So OT works a lot on, like, there's this program called Astronaut Program. I don't know if you have heard it. So it works on the body and the positioning and rotating them. It's so cool. And that helps with the body too.
And that's awesome because, even being in the ABA field, I've never heard those terms before. Yeah. And I think that it's like crazy, right? Because they do correlate so much, but then like we just aren't connected. Like, that's like what you just said sounds so cool to me. Like, it is that they focus on that, and we focus on so much in ABA, and I've never even heard that before. So even to bring something into that as we work on like motor imitation like go so far kind of thing, you know?
And I like Coop said earlier, I just hate the fact that like the only time we get this multi-team discipline is at a once-a-year IEP meeting. Mm-hmm. Like I think that kiddo needs to have continuing meetings with everybody that services that kid. Because when I heard it for the first time, I'm like, oh, shoot, that's why my kid elopes. I'm thinking it crossed 2 or 3 different functions and it's just going to be hard because automatic reinforcement. But no, he's lacking like some proprioceptive input somewhere. And now I'm thinking like, whoa, it's going to be hard to decrease that because I just can't give it to, or a weighted blanket or a weighted vest or this, that, because you don't know. And then that kid has preferred proprioceptive ways of gaining that. So it's like, whoa, it's a lot. Yeah. So I really appreciate what you do and just really appreciate you being probably one of the very few people that can bring both together.
Yeah.
You're cool too. Like you got the tats. You ain't no 55.
No. I feel like I wanted to just touch on that. I feel like we all kind of have our own formula. I always view it that way. So like you said, I just don't know how much. Well, that's the point. We're going to find out how much. And guess what? That formula is going to change even as they get older because what I required now is not what I required 10 years ago.
I know.
So you got to just find that formula. What do they need?
I need your number because I got a 17-year-old. Child, he be,
yeah. My son has ADHD. Yeah. So it's, very active. He's 6.
6,
yeah. Very active.
So it sounds like you're more aligned more with the OT community, somewhat than the ABA community. Man, it's like I wish we had a round table right now where we had a BCBA, OT, and PT, and we all kind of have to
plan it, man. We have to plan it.
Called the IEP team.
Yeah.
I'll be
here.
I like that as a big room thing. I love it.
I love that.
I have the people for it too.
All right,
if y'all think I'm cool, like I know people.
Oh, we need to set it up. That would be a fire segment. Fire segment. IEP team is lit. Now, we know you in your teaching era. You're teaching kind of what inspired you to focus on educating others, like the RBTs, like kind of what inspired you to do that?
I guess because one, I'm done with my like direct treatment era. That's why I was like, cool. I don't got to do direct treatment as a BCBA. That's awesome, and not in a bad way. Okay, I know there's BCBAs out there who want to do direct treatment. I just did it for so long now, and it's kind of like I couldn't. Like, how do you say?
Wait a minute. How old are you?
I'm 31.
I'm 41.
I feel older.
Joe, not ever ask a woman her age.
I don't mind. I don't mind.
But she said she was a millennial. She's cool.
we don't mind. Millennials don't mind at all. No, we're cool. What was I saying?
You were talking about, you're 30. Well, before that, you were talking about how cool you were.
Yeah.
You got the people for the IEP team.
I am.
Yes.
Yes.
No, I lost it.
It's okay.
You asked me something.
I asked you about you and your teaching era.
Oh, yeah, the teaching. Okay. Mm-hmm. So now I feel like I guess I could target more children and more families if I just teach others. Yeah. And then they spread that knowledge out. So you see how much faster it is than me just doing direct treatment all the time. It's just like I want to just sprout faster. And I think that's why TikTok's great, too. I just want to...
Let's talk about your TikTok. So tell us about, is it Mimi BCBA?
Yes.
Okay, tell us about that, what that creative process like, and then talk to us about what's been your most maybe viral or misunderstood moment on TikTok.
Oh, misunderstood moment you said too? Yeah. I guess the most viral was probably like how I passed my exam. That was one of them. And then I share a lot of like ADHD information. So that actually went viral before. But I've been getting like attacked lately kind of when I support remote BCBAs. And I think that's where I'm getting a lot of those comments. And it's like, it's a lot of RBTs and I understand their pain. It's like, but go to my page. Like I'm an RBT supporter. Like I'm always like, I'm for the RBTs. And so I'm like, I wish you could just go to my page. I'm not against y'all. I'm actually with y'all. And I feel like being a remote BCBA is not for everyone, but I did it for 3 years in OT. I directly taught parents to change not behavior. I guess you can call it that, right? Because everything's behavior. I taught them how to change behavior, how to teach them to tie their shoes, how to do their morning routines. So if I can teach parents to do that, if I could be successful in that, then it is possible to do it as a BCBA as well.
All right. So let's have the conversation then, right? As a, former, current, still certified, got my RBT, right? So you said that, BCBA telehealth is something you support, right? Nah, I feel like nah, because I feel like, as an RBT, for one, I think that was a COVID thing. I think the telehealth thing was a COVID thing. And then I think that the second part about that is that like, you just can't support me the way I need you to if you're on a computer. So
for every case, you think? Or are you talking about specific cases?
I don't know.
All right. Listen, I think that, let's say, honestly, every case, right? Because obviously every case doesn't need you in person, but it's just a different feel, right? Even if the kid is 14 and highly functioning, like you being there with me in the house and us going outside to shoot hoops for 20 minutes or the hour that you come by goes an extremely long way, right? And then it's even worse if the kid has behaviors. Like any kid that has behaviors as an RBT, if you're the BCBA, yes, you can say, hey, ignore it or DRO or do certain stuff, but we still just aren't getting that same support kind of thing.
So let me ask you a question. Do you think it'll be better for like kids in rural areas who like maybe have 10 people in their town to have a BCBA that could provide support there or have nobody there at all? What do you think is more impactful?
I think that BCBAs are needed for ABA.
Answer the question directly.
Nah, I think that...
What's more impactful?
Look, I think if I'm your BCBA remotely, you would change your mind.
Ooh.
We're hiring. We're hiring.
And no one's cool didn't answer the question, by the way.
Where you at, Michelle? Drop it out. Where you at?
All right, are we talking full remote?
I could do full remote, but I choose to go in because a lot of my families are in San Antonio and they're far, right? They're not close by. It's up to me if I want to go in person, and I do choose to sometimes go in person.
So were you an RBT before?
No, but I did direct treatment in OT, so I feel like that counts.
I agree.
I think one thing I want to kind of peek into what Coop's saying. This is something that a lot of RBTs do feel. So I'm gonna vibe with you for a minute, even though some of the literature proves wrong what you're saying. But I'm gonna vibe with you for a minute from your perspective. There are a lot of situations where BTs do not feel supported remotely, and a lot of companies actually having some of their BCBAs come back into, spaces, particularly in the home and, clinic, because they have not felt supported. The reason why I asked you that question, because particularly on like when you have severe problem behavior, you can be talking me through whatever. If you're not modeling and being able to use those BST techniques, it's not helping me at all. So from that point, I do get it. I do feel that there are certain situations, that's why I asked you that question, where it is appropriate to have somebody with some professional guidance say, okay, hey, no, let's do this preventative strategy, and to walk you through that. Hey, no, let's respond in this way, and you can kind of get different behavior. But I feel where you come in. He's somebody who's done those direct services. Yeah. And that's his perspective. So I completely understand where you're coming from. However, I do disagree that there are definitely situations where you can definitely improve the quality of life by having somebody be remotely. But I do vibe out with you.
Now, I'm not saying that you can't improve the quality of life,
So we're making positive changes.
But this is what I would say, like, you can do therapy telehealth, right? You can do a lot of things telehealth, right? But ABA is a team thing, like it's a coach, a player, how we kind of went with that, how we started the podcast. But in the sense of that, this is just one thing that, yes, as the BCBA, that kid will make progression if you're on telehealth, right? Whether behaviors or, motor skills, you can do that stuff. But also, too, the other part of that, like, the RBTs just need that support. Like, they just need that person that's in person sometimes. And I own a company now, like I have BCBAs who are telehealth. And that's something that I even get the feedback of like, like I had a rough day. I just wish I had a BCBA that came in once a week and just talk to me, even whether it be like, feedback or how to change behaviors, just having that physical person. Simple, I think goes a very long way.
I am 100% playing devil's advocate.
Okay.
That is just our medical model, brother. Like if LPCs are telehealth, you can find a doctor telehealth. You can find a dental hygienist telehealth. Dental hygienist will be upset because the dentist is not going to be there every day servicing that patient, and the nurse will be upset because the doctor may not walk in. So that is just the medical model of the U.S.
Okay, no doctor is telehealth. Right? I mean, in the sense of
100%
that, doctors will at least. All right, let's say doctors telehealth, right?
Yeah.
But let's say we're talking about in a team effort, right? And in-home and clinical.
Yeah.
I think that in an in-home model, right, which is different from doctors, and yes, you can get a prescription without even seeing somebody nowadays, right? But we're talking about a kid getting better, right? Let's say a patient getting better.
No, I mean, I totally get you, but my thing is that's just the medical model. That's just what this country
I mean,
has.
but at the end of the day, the end of the day, I still go in person. So I still feel like in my heart, if I could, I would. Like a little bit. Like I feel like I pair better with the client, the parents, and the RBT. And then it's nice because like what if you go in there a little bit more consistent and I train a little bit more, right? And then maybe I could kind of like get myself out, you know, then I feel like, okay, they won't depend on that support if I just give them something in person.
Correct. Yeah, I honestly, I love this conversation. And I think there's so many ways you can look at it. Like, Cooper, even to your point, like, you could have somebody, and I love that you were confident, Michelle, and said that you haven't experienced me, because you could have somebody who's a shitty BCBA in person and a competent remote BCBA and actually be more effective. Because I've seen it before and I've been around long enough to see it. So it really just kind of depends on the company, its values, the treatment. There's so much that goes into it. I don't think we can make blanket statements either way, by the way. So I really appreciate it. This episode is brought to you by Adams Behavior Consultant. Visit adamsbehaviorconsulting.com to learn more. They're empowering families, enabling them to help loved ones lead fulfillment and independent lives. Now, Michelle, I want to hop into this lightning round, okay? I'm going to ask you a couple of quick questions, and you just have to give me quick answers, okay? You have 5 seconds to answer each question, okay? You ready?
I'm ready.
All right. OT or ABA, who handles transitions better?
OT.
OT or ABA, who misunderstands behavior more?
OT.
Okay. Well, what's an ABA fad you'd cancel today?
Functions?
Ooh, shit. We gotta come back to that one. Give me an overrated intervention tool.
For OT?
Yeah.
I don't know. Overrated?
Weighted vest. Sorry.
No, those are good. They work.
Hey, don't come with OTs now. Chill out now. Yeah, you don't get somebody in our DM.
Weighted vest on. Every teacher, every kid, weighted vest.
All right, give me overrated OT.
Sometimes we were recommended for behavior. And I just feel like, no. Like, that's not something we do.
Overrated ABA intervention tool use.
I don't know. I don't know enough of an ABA, to be honest with you. Okay. Like, I know enough, but I wish I knew more to be able to answer pros and cons or things I would use and I wouldn't use.
I love the transparency.
Yeah.
My last one, sensory bin or token board, which one gets ditched first?
Token board. No, I don't use them as often.
Oof, okay. All right.
Maybe I should.
That was a hot take lightning round. Brought to you by Sapphire AI. Now listen, I want to dive deeper into this ditching the functions, because you have a lot of people in our DM saying that's what the gold standard of our science is. So I'm going to allow you the opportunity to elaborate on what you meant by that.
I think there's just a lot more to just those 4 functions. And apparently there's going to be like controls coming out. Is there like a 5th function now where it's like all of them? That's what a BCBA told me. Okay. And I feel like there just needs to be more research on that. And like, I don't know, maybe we should just change it. I like that there's a way to describe, there's a function to that behavior. I just feel like 4, a lot of times it's not even just one, right? It's like 1 or 2.
Multiple,
it's like multiple. So it's like, let's change the name or let's change the game of that. And like, let's give more. Let's talk about neurological. Let's talk about the way the regulation system works. How do you just change behavior? I guess you can, because there's respondent conditioning. And that's huge, right? I think we need to dig into that too, more of the respondent conditioning. We need to be more like radical, right? We need to start blending multiple things together to change behavior. I don't think there's just this approach that we're taking on a function.
So I want to say, right? So essentially, what I'm hearing is that what we touched on earlier is we need to come together, right? Because ABA with the science is limited. We're only taught certain stuff. And even as we spoke in this interview, you gave us game 1 things that we haven't heard, right? So let me ask you, what is something that you think we can do to bring OT, ABA, speech together?
I think... like you say you had your own company. So I think what you need to do is start to educate them and that be your route. So when I got hired into this company that I used to work at before, that was their model. They're like, we're going to teach you. We are going to fly you out. We're going to get you some cool CEUs. This is a list of the ones we want you to do. And I'm just like, I want to do feeding. I want to do reflex. I want to do this. I want to do that. And they paid for those things. So of course I'm going to go do it. And I did it. And then I get to educate people, the group of it. So let's say I go for feeding, I'm going to go and do a presentation for it. Beautiful. Like, I think that's what needs to start happening, is start using those tools of education and just blending that together. Because guess what? I have tools that speech has taught me, like tongue elevation, doing tongue exercises. I work on those reflexes. I understand what it means for pocketing. Like, I know how to even refer out because I know what I'm looking for. There's people that don't even know how to refer out or where to refer out. Tongue ties, that's huge, y'all.
Yeah.
That's all connected.
Yeah, absolutely. I mean, this is one thing that I wish we had more of. That because, okay, PSA to all my ABA professionals and BCBAs, we don't know everything, all right? And we walk around in these IEP meetings, we walk around and we think we know everything. BCBAs think we have all the answers. And don't get me wrong, we do bring value, but this is a team collaborative effort. And to Coop's point, we really need this collaboration more. You know what I mean? I wish we had, who's our brother that we had on here, the speech guy? What's his name? You know what I'm talking about, though.
Sagan.
Yeah. I would love to have him on here. Kevin, have Kevin on here, have Michelle and have on here. We all talk about how we view things and come to an understanding because we don't know everything. And I think that's the theme that we're getting here from this conversation. I love it because you don't see, as Joe said, we talk one time a year. It is at these IEP meetings. Like usually when I see the team members, and that's when we chop it. And at that, we're trying to get IEP goals in. We're defending narratives and that thing. So this is a PSA announcement too. To I don't know how it's going to look. Maybe we can do a segment. Hashtag IEP team, that'd be a dope segment. But we got to get more people in here involved because I know there's a lot of things I'm writing behavior plans for. I'm not gonna lie. I'm like, man. It is, I see it as is because that's how I was taught the science, but then the way you're describing how behavior's been worked, the underlying, the sensory needs and all that, I don't know that shit. Yeah. And like, I wish I knew it, but I don't know it. I want to learn more. Yeah. I would love to collaborate more to learn, okay, this is how you see it. Let's try this. Let's incorporate this into our behavior plan and see the effects on it. So I'm loving this conversation. Okay, I want to get into representation. All right. I want to get a little bit deeper. All right.
Let's do it.
Can you talk about your experience as a Latin woman in this field that typically rewards conformity, to conform to a certain way, to look a certain way. Talk to us about how that is. What's that been like for you?
I think it starts when I worked at a hospital. So, and it's also back then. I feel like it's definitely changing a lot more now. But, it's like, no piercings, no tattoos, no colored hair. You got to pull it back. You have to speak a certain way. You can't have some, not even an attitude, but you know what I mean? I'm a Latina, so like I have that vibe with me. And so you're just in this box. I was in this box. Depression happens. Like I was like, well, when can I express who I am without being judged, right?
Code switching.
Yeah, for sure. Yeah, I've heard of that actually recently. It's a thing. And then I got into OT. Again, I felt like I was a little more important. And then it started to kind of be a little more flexible. I even went to interviews and I'm like, do I have to hide my tattoo? Yes. All right, bye. I'm not going. I don't have time to do that. I have a lot of them, and I don't need to take my piercings off every day and things like that. My quality of therapy is there. So that has nothing to do with it. And now that I'm a BCBA, I feel like the ABA world is a lot more open because we hire a lot of different people, yes, right? We really do. So I feel like that opened up even more. And I come in here and I'm kind of like, people, or especially parents, right? Caregivers, they look up to you. I don't even think they care like the way you look. They're just like, come on in. I need help. That is my number one priority right now. And I feel like now I do feel like I'm a little more open with that. And I'm to the point where I'm not covering my tattoo. There's nothing bad. Okay, as long as there's no bad words, there's nothing that is not appropriate. Like, I love to express who I am. I'm tired of being in that box. And that's the first thing I ask again is like, what is my uniform? What do I have to wear? I was working at a clinic before I did in-home. And they were starting to, only scrubs, only this. You got to look professional. And that just, again, it started to bring me into this box again. That wasn't the reason why I left, but that was like another reason to add to that. And I'm like, I can't do that. And so now I picked a place that they're like, you're great. And yeah.
Okay, so this is a conversation we don't have too much on this podcast. I'm glad you're here now. There's people watching you right now who probably can relate to the things that you're saying. I know there are. I know some personally. So what would you say to somebody who's queer or neurodivergent or visibly different, who's just starting out OT or ABA? Like, what would be your message to them watching now?
Just, if you go in being yourself, then it's not like you're going to be peeling layers of you to express that eventually. It's like, and it hurts, right? It's like all of a sudden I'm like, I'm marrying a woman, like, you know, or like if I want to share something about, you know, my kids, or if I'm talking about my family, eventually being married or going to be marrying a woman, it's going to come out, especially if you're with families and you're learning about families and things like that. Those things are going to somehow come out. And so it's like, I started to be that way. It's like, well, I'm queer, you know, my tattoos and like, so now I just go in there and I'm like straightforward. It's so much easier. Because if not, it's like, oh, I'm finally going to tell my families, like, you know, the reason why, or, you know, or they'll be like, oh, is he, like, they'll say like, oh, your fiance, is he going? I'll be like, she. So I feel like now I'm entering there and I'm just spilling it all. And I'm like, just don't question me at the end of the day. Like,
so are you okay with families not being okay with that?
That's a good question.
That is a really good question. So far, I maybe came across that one time, but I don't think we were together long enough for me to express that just yet. But I don't know. I guess, I don't know, because I care a lot about my clients and I care a lot about behavior changes. But if they already have that mindset, how much more am I going to come across that are barriers? And I understand respecting culture and cultural competency and things like that. But then it's like, I'm so open to acceptance. I feel like it should be the other way around too.
But isn't there kind of a part where you're coming in as my child's BCBA, like what you do in your private life, you know, doesn't really pertain to, and again, you want to express and be vulnerable and be a person with the people you work with. But is there a part where maybe, you know, we just don't have to speak about that? I'm here to get these behaviors in check. I'm here to have your kid be able to say his name and be able to learn how to eat. And, you know, are you okay with that? Or do you feel like, nah, I kind of have to be comfortable to express myself?
I think in order to pair and get to know the parents, I think you have to be vulnerable. You have to show vulnerability first. And then they start to show vulnerability and the ability to also change even their own behaviors and habits around their own child. So I think that is what I've been using lately. And it's actually worked to the point where they're kind of like telling me I need to change my behavior then. How can I do that? And so I've been trying this different approach where I am starting to be more vulnerable in that sense. And I see that reciprocation and it's beautiful. So if I do come across that, I mean, we'll see how I handle it, because not yet. Not in Texas.
Oof, and you live in the deep south too, guys. You're listening to Beyond the Science. We're live here in Atlanta, our ABA studios. Michelle is joined with us. I'm here with my fantastic co-hosts, Joseph Adams and Darius Cooper. Shout out to Alex, AG Productions, on the mic, ones and twos, recording us. Did you bring your journal?
I did not. I couldn't fit it. I didn't bring it. It's okay.
I wanted our listeners to see the journal.
Well, I collaborated with Alex from ABA Exam Review. And so what I did in this journal, I'll describe it to you, is every page of the task list has QR codes to a video of mine and a video of his. Because he explains ABA so beautiful. I passed my exam because of his videos. Beautiful. Wow. Yeah. And then mine is like the more, I guess, simple explanation, kind of like I use more of a everyday language, but it's not the best way to pass the exam, but it gives you a different perspective of how to process that information. So every single page has a video and it's like this thick. That's one of them. So yeah.
All right. Well, maybe you can send us a picture or something so we can include this in here.
Yeah, I will.
All right. We're going to transition to Straight Talk with Joe.
Well, Michelle.
That rhymed, actually.
Well, Michelle.
All right, Dr. Seuss.
Right. You said something earlier about your son, right? Your son is 6, correct? And he has that F90.2, that ADHD diagnosis. My daughter has one as well. But it appears in girls differently than it does boys, right? My daughter could look dead at you and just be, she's just not getting it, right?
Yeah.
But she's really focused when she plays a sport. How does it appear in your son, and how
I could talk about my daughter because I still haven't gotten a diagnosis, and I know she has it.
Yeah. So let's talk about that.
Yeah. So that is a great question because my daughter still doesn't have a diagnosis, but I know she has it because she is a great example of me. So long story short, my brother was diagnosed when he was little. So I know
diagnosed with what?
ADHD.
Okay.
So I know we have it in our history. I was diagnosed at 27. After a year of multiple medications, like we went through the whole rabbit hole and then eventually got diagnosed. And I'm still having trouble getting a diagnosis for my daughter because the way she represents it's like it's so internally, right? But in school, she's great. Behavior's great. But academically, that's where we're seeing a little, and then emotionally, she tends to withhold everything. And then at home, it's like, you know, and I'd rather her do that. I'd rather her come home and release what she needs to release. And then, you know, my son is the basic hyperactive, got diagnosed at 4. Wow. They don't even diagnose that early. Wow. So he was skateboarding at 10 months.
Wow.
This kid, like on a skateboard, pedaling at 10 months. So do you see the difference in like the way my daughter demonstrates ADHD versus my son and how it's still very difficult? I sometimes educate people just to get a referral out. I'm like, I'm a behavior analyst. I study behavior. Like I did LT and like I just have to dump it on them so they can listen to what I have to say.
All right, guys. The anticipated, the asked for, the one and only. Let's transition to Coops Off the Clock.
All right. I need a good one, man. Last one, they edited it out, you know. All right, so I want to ask you, right? You know, we all have so much going on, you know, working, mother. When you completely turn it off, what does that weekend look like for you?
Honestly, I like to book like little mini vacations.
Okay.
Like that's why I'm here. And then just get out and just actually close ABA in my brain because I'm just too involved sometimes.
So what was your last dope mini vacation?
I thought it was going to be considered Costa Rica because I didn't think it was that beautiful. So that was supposed to be like a mini one. Like we quickly went there for 2 days, 3 days. No, it was like I should have planned more. Like I should have done a whole week. It was supposed to be just a quick little like let's just go to Costa Rica.
Oh, you loved it out there?
I will go back. Oh, it's so gorgeous out there.
All right, I've heard a lot of people tell me they go to Costa Rica, but because you're in Atlanta and we have somebody here from Atlanta, Joe, she's here. She has a few more. How long are you here?
Till Sunday.
Till Sunday. Joe, give her 3 must Atlanta things to do here. And the Atlanta people are watching you. So if you fuck this shit up, they coming for you, Joe.
I am. I will.
Okay. You have to go to the Varsity. That's an old school Atlanta thing.
What is that?
The Varsity is like hot dogs, hamburgers. This is like 90s Atlanta. So like I'm ATL beyond. But now the younger generation, yours, they're going to the Trap Museum, T.I.'s little joint. Okay. That's pretty cool.
Trap Museum, okay. Respectable.
I would do that. I would also visit either Atlantic Station, Beltline. Okay. That's kind of modern Atlanta. Right.
Okay, good yard house.
A good yard house in Atlantic Station. This is cool.
All right, hold on, y'all.
I know this song too.
All right, guys. I'm gonna tell y'all right now. I've lived in Atlanta for about a decade now, and that list was trash. Absolutely trash. Do not go to the bar. Do not go to the Varsity, y'all. Okay, scratch that off your list. The Beltline's a little tourist. Alex, you're from Atlanta. Would you recommend the Varsity? Yeah. Joe, you stick to your straight talk because that was a trash list. I mean, you didn't tell us to go to movie, dog.
Atlanta's different. Now I got some money, but you didn't have money.
I got money.
That's an intro.
I got money. Just come back on Monday night with me, dude.
You gotta tell them where to get some real food at, man.
Please.
Some soul food.
Yes, that's what we're looking for.
Some lemon lemon pepper wings, some Mac. Okay, Fat Max is reputable.
Fat Max.
That is reputable. I'll go with that. Okay. Why you telling the varsity though? Why you telling the varsity?
That's just like if you come into Atlanta. I guess I was thinking 90s, but then now it's 2025. So if you come to Atlanta, like that's what it was.
Okay, I'll go. I'm gonna leave you a Fat Mac because people watching my ATL, they're gonna agree with that. That's a dope spot. So I'm gonna let you in there.
Yeah, let me have that.
All right, momentum. And we gonna edit it out a little bit. I'm so ATL. All right. Jokes aside, winding this thing down, this has been a wonderful episode. Thank you for being so vulnerable with everything going on in your life and the perspective that you bring. As we wind down, anything you want to leave with our listeners, anything that we get in touch about, any last message that you have that you want to make sure that you share?
Just always be yourself. I think that is something that is going to be very powerful for not only yourself, but those around you. And you're only going to attract people like you. And that's what you want. You know, you don't want, and this is not career, not like towards being a professional, but in general, because then you don't have to like pick out things that or people that you don't like. It's just kind of like if you just start with who you are, that's what you're going to attract. And I've learned that the hard way, and I've learned that for a very long time. And I'm very happy now. At 30 years old, I feel like this is a new great. Would you say anybody 30? 30?
He's 30.
Absolutely, yeah, he's
30. 30s are it. 30s are it. I don't know about 40s.
40s.
Better?
40s ATL list.
Man.
Quick question. Are you a Spurs fan?
I'm not really into sports.
Ooh.
Yeah, I'm just yeah.
He was waiting on you to say yes too.
I was waiting on you.
Charles Barkley out.
I've been to a game and it's really cool.
Where can our listeners find you? Give us your TikTok, your gram. We'll link this in about it, but what can everybody find you and learn more about what you're doing?
Yeah, so you can find me on TikTok at Mimi BCBA. I think my Instagram's the same. Let me look. I'm not popping on Instagram, but please follow me so I can start popping on Instagram.
Ooh, yes.
Please. Same at Mimi BCBA. I'm also on YouTube. That is, I'm like at 126 followers now.
Hey. All right.
That one is at Declassified ABA. I do post more like education stuff for that. I tutor as well for the BCBA exam. I do it all, man. I do it all. I'm very, I think that's it. On my socials, yeah.
Right, before we go, we need one more that I got money for our punchline. Play the song. There you go.
He wanna give me 10.
No, I'm telling you, I got money.
I know. I'll say something. I don't know copyright. I'm gonna pay 5 seconds of this. Nah, seriously, this has been awesome. Shout out to Sapphire AI. If you guys, just wait on it. Okay, remember I said that name, Sapphire AI. Shout out to AdamsBehaviorConsulting.com. Alex back on the mic. We're back here in the studio. Michelle, thank you. We're going to come back and have the IEP team. I'm telling you. We're going to have a segment and we're going to invite you here.
But we have to do it. But we have to do like where we come in with papers and everything. Like we have to do a whole skit. Like you're ready. Like we're about to fight or something. But oh
shit.
BCS movie? Wait a minute now.
If y'all didn't know, Michelle also has her own podcast. So make sure we'll put in the link. Please follow her, listen to her journey. She's doing some big things. Thank you so much for coming, man. Enjoy the rest of Atlanta. I'm gonna give you a list when we come up here. The real list of Atlanta. I'm gonna give you. It won't be the varsity.
Yeah.
All right, it won't be the varsity.
I wasn't trying to take you nowhere. I'm just...
All right, guys. To our listeners, thank you for following us. Please continue to subscribe to our YouTube. Shout out again to our 500 on YouTube, 10K on TikTok. Michelle's like at 15K, so she's like
almost 17K.
She's at 17K, so y'all make sure y'all continue to follow this beautiful sister, everything that she's doing, guys. We'll see y'all next time. We have some amazing episodes coming up. I'm so ATL. Can we end on that?
We probably can.
We got 5 seconds. All right, see y'all next time.
My respect, always bring it.
That was fun.